Good afternoon, everybody. Thank you so much for joining us for our HealthLinks webinar today. My name is Michelle Hahn, and I am the Community Programs and Events Manager for HealthLinks. And I always have the pleasure of putting together webinars and working with our partners to bring you presentations that can help your organizations build a culture of health, safety, and well-being for your employees. So today I'm really looking forward to our topic about active commuting as a way of promoting health in the workplace. And I'm joined by my colleague, Dr. Molly Tran. Dr. Molly Tran conducts research here at the Center for Health, Work, and Environment and is also the director of our Occupational Medicine Residency Program. And she studied the promotion of active commuting in workplace health promotion as a way to both promote physical activity and also bring together local businesses as stakeholders to demand better built environments in general. So Molly, thank you so much for taking the time to be here today to share your expertise and knowledge with us. We're excited you're here. And before I hand it over to you, I'm going to just go over a couple of housekeeping items for everybody. So as you all may have noticed, you're on mute. We're going to keep everybody on mute throughout the duration of the webinar so that we don't have any problems with our sound. If you have a question or a comment that you'd like to provide at any time during the presentation, please feel free to type it in your question or chat box. There should be a control panel on the right-hand side of your screen where you can do that. And I'll field the questions on behalf of you all, and Molly can respond to them as we go along. We are recording the session, so we will share the link to that recording so that you can share it with your colleagues or anybody that you think might be interested in hearing about the information presented today. That will be sent out in a thank you email tomorrow with any resources that Molly would like to provide as a thank you and follow-up. So stay tuned for that email, and we'll make sure that you have everything presented. With that, I think that covers everything. So Molly, I'm going to hand it over to you to take it away.
All right. Well, thank you, Michelle, for that very kind introduction. And thank you to the audience out there for attending. So yeah, today I'm going to talk about active commuting as a form of workplace health promotion. And I figure out how to forward these slides. There we go. All right, so our objectives today, I'll define active commuting just so that we're all on the same page about what I mean when I use that term. We'll describe the health and some other benefits of active commuting, and we'll talk about some ways that companies can encourage active commuting to work. So of course our commute, usually we say that word and we think about something like this, right? Being stuck in traffic. But really commuting, right, just means traveling some distance between your home and your place of work on a regular basis, going from home to work and back. When I talk about active commuting, I'm referring to basically walking, bicycling, or doing some other wheeled form of transportation like a scooter or a wheelchair, or taking public transit. And I include transit here because studies have actually shown that train commuters walked an average of 30% more steps per day, and were 4 times more likely to walk their 10,000 steps per day than car commuters. And that's just for their commuting travel. So that makes sense again when you think about it. Usually you have to walk to the bus stop or to the train stop, and then perhaps do some more walking when you get to the other end. So there's usually some physical activity involved even in taking public transit. So how are we commuting now? Most of us by car. So currently 86% of US workers use an automobile to get to work, and that's either in a single occupancy vehicle, and you can see that's how most of us do, 76.4%, or a small amount of people are carpooling, another 10%. And then, very small percentage of folks are walking, about 3%, taking public transportation is about 5%, and cycling nationwide is less than 1%. Certain cities have higher rates than that. And that's not without consequence. So the average one-way commute in the US is 25.5 minutes. So this is something that we're spending a lot of our day doing when you think about, basically spending almost half an hour going one way and then doing the same in the afternoon. So why commuting? Why do I focus on commuting, and trying to get physical activity in commuting? Well, because this is something that we do every weekday, twice a day. It's very habitual. And so it really has this neat, ability to, if you get people incorporating physical activity into it, it could be a way that, you're getting physical activity in your day without even really having to think about it. You don't have to make a decision to go to the gym, when you're home from work and you're tired and you need to fix dinner and your kids are, wanting to see you. You've already done your physical activity. And it's also, something that you're already doing, and for many, a really accessible way of getting physical activity. All that being said, I really just like that it's summed up in this quote that I read yesterday from someone who was talking about why he actively commutes. And it's really just that, it makes it bite-sized, unavoidable. It's in his way. He has to do it as part of his routine, and that's exactly why I like it too. I'm not a gym person, but if I get my bike in, in the morning and the afternoon, I've got some physical activity, and I don't have to, think about it and really make a decision to get out and go do it. So let's talk a little bit about what the costs are, both physical health-wise and financially, of the fact that 86% of us are driving for our commute. And one of these is the cost of crash injuries. So the World Health Organization tells us that there are 1.24 million deaths on the world's roads in 2010, and that prompted them to actually designate the decade that we're currently in as the decade of action on road safety, because they project that it will become the 5th leading cause of death worldwide by 2030. And just for those of us who are kind of more in the occupational health field, where we're not necessarily thinking about, car crashes all the time. We're thinking more about, industrial kinds of accidents. But the annual risk of dying in a road crash for drivers who average more than 25,000 miles per year is actually comparable with the risk of dying in the coal industry and worse than the construction industry. So it's something that we don't really think about very often because it's really just something we do as a routine, as part of our day. It seems very, familiar, but there's a real toll there. And there's a real toll to businesses as well. So road traffic crashes actually cause U.S. employers $60 billion annually. And off-the-job crashes, so, you're not driving, for work, you might be commuting to work or you might be just driving around, make up a third of that cost, so $20 billion per year. And just to put that in perspective, the annual cost for chronic illnesses due to smoking is $100 million per year. So orders of magnitude different. And that, crashes are actually much, much more expensive, but we don't often sort of think about it. There are 7 million lost workdays per year because of crash-related injuries. And when you think about it, motor vehicle crashes also drive up the cost of work comp, of Social Security, and of private health and disability insurance. Again, just related to commuting, drivers who are injured when they're commuting are actually more likely to be permanently injured or die than those who were driving and injured while they were driving on duty. And if you think about it, that may have to do with, we sort of have more regulations in effect for people who are driving for work. You're making sure they're wearing their seat belt, and, you may have policies about not using cell phones, things like that, whereas people are on their own when they're driving, to and from work. Another cost is the health cost of physical inactivity. So we all are well aware, I think, of this issue that 40% of the population is totally sedentary, and of course that has effects, on cardiovascular health, stroke, the risk factor for diabetes, for cancer, and for depression. And it costs $77 billion per year just in direct medical costs alone. So we have a huge issue with physical inactivity, and of course, I think in many of our workplaces, we're often trying to find different ways to get people, up and moving around, whether that's standing desks, treadmill desks, encouraging people to, walk to the further trash can. Many, many ways we're trying to get people to move, and this is another way that we could get people not sitting for half an hour each way every day. This is just sort of a little rip from the headlines that I saw this weekend, where, I think the science keeps going back and forth about the role of physical activity as far as losing weight, whether it's more important the calories you take in or the physical activity level. But this was a small study that they actually followed contestants from The Biggest Loser, and saw that the ones who, their initial weight loss was actually really based upon how many calories they could eliminate from their diet. But the ones who managed to keep off the weight for years and years and years were the ones who actually incorporated a lot of physical activity into their sort of post-show routine. You know, it may not be as much about losing weight as maintaining a healthy weight. And of course, there are actually have even been studies that have linked obesity to spending time in a car. So this one study found that actually spending an additional hour per day in the car increased an individual's odds of being obese by 6%. And we don't know, you know, if that's simply the extra sedentary time, or if that's also because, you know, you spend an hour in the car sitting and then you have no energy left to go do physical activities later on. They've also actually done studies where they've looked at the relationship between gas prices and the rise in obesity, and found that 8% of the rise in obesity between 70s and 2004 is actually attributable to the drop in gas prices, and really a concurrent increase in driving. There are costs to your workers' productivity and to their stress levels. So studies that have actually measured, you know, stress hormones in people's, I believe this was in saliva, found that commuting by car elevated their stress markers, like their blood pressure and their hormone levels. And also they found an association with absenteeism, with reduced job satisfaction, and with decreased task motivation among folks who had car commutes. And actually the length of the trip contributed was directly related to the stress level experienced by the workers. So those who had longer commutes, longer driving trips, experienced more stress. And of course, there's a cost to the environment as well. So, you know, cars exhaust is one of the major contributors, you know, to greenhouse gases and other emissions that lead to climate change, as well as a big, and actually the main source of the particulate matter in the air that can exacerbate a lot of, you know, lung conditions like asthma and COPD. So, you know, if you're a business that's aiming to be green and aiming to be environmentally friendly, but you're, you know, still basically incentivizing your workers to drive, then you're really kind of working against your own goals. So that's the cost of the status quo. What are the benefits to active commuting? Again, walking, biking, or taking public transportation. So active transportation in general has been associated with an increased likelihood of meeting the CDC recommended daily physical activity levels, lower BMI, lower waist circumference, and lower odds of developing high blood pressure and diabetes. For the commuting aspect in specifically, so the previous was for all active travel. This is for specifically just active commuting to and from work. That aspect alone can actually have a huge impact on health. So studies have found that active commuting that incorporated walking and cycling, so this one wasn't necessarily looking at public transport, was associated with a decreased likelihood of obesity, lower triglyceride levels, and lower blood pressure among men. It also found increased fitness and an 11% reduction in cardiovascular disease risk. For those who use light rail to commute, they found an association with a little over a point reduction in BMI and an 81% reduced odds of becoming obese in the long run. It's also been associated with psychological well-being. So this is a study that was done actually among British adults, but it found that those who walked, biked, or took transit had a greater sense of well-being than those who drove. And the difference was especially significant for those who switched from driving to walking or bike commuting during the study. And actually for that group, the observed increase in their well-being was apparently as great as the difference between those who reported being in a relationship versus being single. So happy Valentine's Day, go, you know, take the train. And yet, you know, if we see these health benefits, and then we see the reality. Only 28% of people did at least 10 minutes of transportation-related walking in the last week. So we really have a lot of room to improve. And I think this, you know, really relates to our workplace health promotion programs, because what are we often trying to do in our workplace health promotion programs? Get people moving. So this was a 2008 study by the Kaiser Family Foundation where they surveyed, all these different companies and what are they doing in their workplace health promotion programming. And you see, weight loss programs, gym memberships, having on-site gyms, health coaching, all these, things that are trying to get people physically active. And yet, often our workplaces look like this. So this was a picture I took of a place I did a rotation when I was a resident that I just thought was so funny because actually inside this building is a gym. And the sign, you can't really see it because of the glare, but one of the things that directs you to is like a walking path on this campus, outside, encouraging people to go walk during work, get their steps in. And yet, you see the sea of just a parking lot, no sidewalk. I was like the one crazy person who took the bus out to the site and then risked my neck walking through this parking lot to actually get into work. So, we often have sort of a disconnect there. So, you might be thinking, great, but everybody at my office who drives, I'm not going to get them on a bike. That's crazy. They're going to drive. Maybe. But there is actually some evidence that, employers can influence how people choose to get to work. So, for example, one study has found that people are significantly more likely to incorporate walking or cycling into their commutes if they have to pay for parking, or if they don't have parking at work, which makes sense. Or if they reported a supportive environment for walking or cycling along their route. So, there were sidewalks, there was lighting, perhaps a bike path or a bike-friendly street. So, again, these are some things that you as a workplace can actually do to influence people, to get out of their cars and to get active. Other studies have shown that having and making use of an employer-sponsored transit pass was significantly associated with meeting physical activity recommendations, and that makes sense because, again, we know that people who take the train are more likely to meet their physical activity recommendations. And a study down here in Denver actually showed that employees are 67% more likely to use transit if they're provided a transit pass as part of their benefits package. On the other hand, they're 88% more likely to drive alone if they're given a parking pass. So you can really, sway things either way. I add this in here just because I often get this question of, well, that's great, right? But we're always not somewhere else, right? So we're not California, or we're not, somewhere that's warm all the time, right? It gets cold here. And so this is actually just a graph where you can see this black line actually shows the number of annual days where the temperature is below freezing. So we kind of go from, Honolulu and Long Beach and warm places over on the left side to, cold places like Chicago and Milwaukee and Minneapolis on the right. And then those red dots represent the percent of the population that walks or bikes to work. And you can see it's a complete scatter. So there's no actual relationship between cities that are really good for biking or not good for biking and weather. As the, I believe it's the Swedish say, there's no bad weather for cycling, there's only bad preparation. So, okay, I've suggested that there is something you can do. You can, as an employer, influence, how employees are getting to work. And hopefully I've convinced you that it's the thing worth doing, that there are health benefits to walking, biking, or taking public transportation to work. So what are some concrete things you can do? So I'll kind of give you the full tour, the full range. And we'll start from the sort of good old trusty old Schwinn that's pretty cheap and easy, but still gets you there, and go up to the, super fancy carbon fiber, really fast and light, but, more expensive and maybe more intimidating version of things. I was originally going to call that the Cadillac of encouraging active transportation to the workplace, and then I realized that was completely, the wrong analogy to be using. So we'll call it the really fancy carbon fiber bike version. And by the way, I own the old Schwinn and the middle kind, so I'm not just either of those. So we'll start with just kind of the basic model. So one thing you can do is look at the physical structures in your workplace. So if you want to encourage, folks to bike to work, you have a safe place for them to store their bike. And, first off, the very basic, right, is to have a bike rack. Otherwise, they can't safely, lock their bike to anything. Even better, can you make it a little bit more of a secure feeling place, right? So is it a bike rack kind of out on the periphery, no lights, and you really feel like someone can come along and take that bike? Or is it, somewhere close to the building, perhaps covered, so that if it rains during the day, you're not sitting on a wet seat for your ride home, even perhaps somewhere indoors that they could bring it. Other things that you can do to encourage cycling to work, offering a place to change clothes and perhaps store clothes if people are wearing, different clothes to bike into work and to be at work, which isn't necessarily the case, but some may. Some workplaces actually, if they have a on-site gym, will allow folks, even if they're not gym members, to use the shower facilities when they come into work if they biked in. So basically, if you bring in your bike helmet, you can go and use the shower and locker room facilities to get ready for work. And even things like sort of on the lower left here, you see this little bike repair stand. And this can be something that really gives people the confidence that, if they have a little bit of trouble with their bike on the way in, they can fix it up and still be able to make their ride home. These are pretty small, not super obtrusive, but are really useful. We actually have some of these on our campus here at Andrews, and I've made use of them. One day I was riding in and my bike seat for some reason got really wobbly and started sliding down, and it was really uncomfortable to bike. And, they have all these little hex wrenches and things kind of on chains so they don't get lost. And I was able to fix my bike and ride home comfortably. And then as far as the physical infrastructure, do you have if you're trying to encourage people to take transit, do you have a transit stop, at your, campus or your office? If so, is it a pleasant looking place, or is it, somewhere that seems really scary to wait, right? Is it lit at night? Or if it's not, is there somewhere, or can you make provisions for somewhere that your employees can, be waiting indoors and still see, their bus come? Again, that was something that was always a challenge, for me when I was taking public transit was, as a female, if it's this time of year and it's getting, dark pretty early and you're leaving work, you don't want to wait at that bus stop that's just like a sign in the ground with no lighting around. And so, is there something that you can do to either improve maybe a stop that's on your, property, or perhaps provide a safe place where people can wait? And can you make it a pleasant place as well? You can look at your policies and your office culture. So, as far as policy goes, and not all of these solutions are going to fit every workplace, but, can you perhaps offer flex time? So if there's someone who wants to, take the train in or take the bus into work, but they have to be at work right at 9 and the bus is going to get them there at 9:15, then they're going to have to drive versus, if you can say, use your flex time, you can come in 15 minutes later, stay 15 minutes later, or something like that, then, that might be a really simple way of, allowing people to have a little bit more flexibility if there's some variability in their work commute because of, public transit schedules, or because, they got a flat today and, so it took them a little bit longer to get in. Another thing that people just don't often think of, and again, this might not work for your workplace, but it might, is sort of what is the social dress code at your workplace. Do you need to look like, the guy on the very left? Probably not, but, is it a place where, it's okay for people to maybe show up looking a little more, on the business casual route? So they might be able to, again, like wear more weather appropriate clothes for transit or, cycling in. To work and not even have to do a change. Again, that might or might not work for your workplace depending on what kind of, office it is or workplace that it is, but something that people often just don't even think of as being a barrier. And then finally, can you set up either a website that folks can use to explore their commute options to work. This is an example from the University of Washington, where people can go on and, say where they live and where they work and kind of look at the different options and how long it would take them. Or is that something that you can do just using the resources you have even, within your workplace? So, do you know people in your workplace who bike to work or who take the train or the bus to work? And can they serve as a resource? And often I think people who have figured out, taking the bus or walking or biking are very enthusiastic about talking to others about it, because usually they find it a pretty, pleasant way of commuting and of getting in. And usually there was some figuring out to do, and so they're happy to share that knowledge with others. So there are various ways that you can do that. Maybe you actually set up, support networks with folks who, someone says, I'm willing to be the person who, helps people figure out a bike commute, or, I would even be willing to go and take the train with you one day, or people who are just even willing to kind of just be resources to talk about it. And I find often that really is the little help over the hump people need. I even did that when I was in residency with a friend of mine who lived in the city, and she had been driving and she wanted to explore taking the train, but she just was very intimidated by it. Often when you're taking public transportation in a new city, it's kind of scary. You're not sure if you're on the right platform or the right side of the street, and it's going to take you where you want to go, or if you've already missed the bus, or is it still coming, things like that. So sometimes you just need, some literal hand-holding to get people over that hump. And finally, looking at your benefits, and this is really, a major spot where you can incentivize sort of healthy behavior or less healthy behavior. So probably a lot of folks are aware that, there's a federal commuter benefit that allows you to basically deduct, the following amounts pre-tax from your paycheck. So for fiscal year 2017, you could deduct $255 a month for parking or $255 a month for transit passes. And there's actually also a bicycle commuter benefit, where if you're not receiving either of those and you're actually biking into work, you can get $20 a month for bike commuting. So, the more of those options that you're offering, you may actually be encouraging people to look at, taking transit rather than, using that on a parking pass. And I will say this, even for myself, one of the reasons I got into this work was because I did my medical school and my residency in the same place. And as a medical student, I got a free pass to the light rail. And so I took the light rail. It was really convenient from where I lived. And then I became a resident, and my sort of employment status with that university changed. And suddenly I got a free parking pass, or I paid $80 a month for a transit pass. And, as a resident, medical residents aren't, so well known for being flush with cash. So of course I took the free option. Even as someone who really actually would prefer to take the train, I was being incentivized to drive, and so I did. And that brings us to parking. Now, parking is, I think, often the third rail of this issue because people like their free parking. But, you do need to think about it in relation to incentivizing active transportation to and from work. As we saw, in that previous slide, one of the things that made people much more likely to incorporate, walking or cycling into their commute was having to pay for parking at work. There are a number of ways that you can address this issue, though. So you don't have to take away parking entirely, or necessarily even charge the full market rate, but charging something does help. There's also an option of parking cash out. So this is where if you are a workplace that offers subsidized parking, you can also offer the alternative of getting a cash equivalent if they don't drive and use the parking. And this has actually become law in California. And I'll show you on the next slide that it's been pretty effective. There are other things you can do. So travel allowances are a way, again, of basically providing a financial payment to employees. So instead of offering parking subsidies, you just give them the money that you would essentially be giving them in the form of a parking subsidy. And they can choose to use that money to pay for parking, or they can choose to use that money to, again, pay for a transit pass, or, pay to upgrade their bike, or bike to work and save the money. And then, of course, as we mentioned, offering transit and rideshare benefits, either free or discounted, can really change the economics of choosing to drive or, take public transit to work. And finally, looking at your travel policies and reimbursement policies for company-related travel. So, sometimes a company-related travel policy will only talk about reimbursing automobile mileage. Well, can you make that language more inclusive and actually reimburse bike travel or transit travel mileage, for business trips where those are actually pretty comparable in speed to driving, which would often be, if you're in a major city, often be a lot of your within-town travel would be just as quick to bike or take transit as to sit in traffic. And this is just showing the impact of that parking cash out option where, again, if you're providing subsidized parking, you can also give the option of a cash allowance in lieu of a parking space. And you can see, before cash out compared to after cash out, the drive alone rate dropped, the carpooling rate increased, and the transit and walking rates increased as well, biking and walking. So those are kind of, I think, the really basic level things you can do, right? Just look at what you're incentivizing. Look at your physical space, your financial and sort of benefits, and look at, your company culture and policy and see, where can you make, some small changes that don't necessarily cost a lot. This is sort of moving into the slightly, it would take a little bit more, but it's not undoable. So one thing is to look not only at your property, but perhaps, what we call in the sort of active transportation world, the last mile, right? So often we can get somewhere almost, but it's that last mile to work or home where there's a problem and there's something that's keeping us from being able to, take transit or walk or bike. So you might want to look, at the area surrounding your workplace. And actually see, is there some small thing that's keeping people from being able to, actively commute to your workplace. And this is a good time to either go out and try it yourself, or, ask if there are people in your office who really want to take transit or who really want to, bike to work, and ask them why they don't. It may be issues of time or who knows, but it may be, just that last mile around your workplace. And the reason why, I bring this up also is that from the transportation and active transportation advocacy world, which I'm also involved in, where we're, going to local governments and trying to get a bike lane put in or trying to, get a crosswalk put in, things like that. Local business is a huge voice. And something that, the local governments don't want to get on the wrong side of. So if you're actually coming to them and saying, we want, a traffic light, a cross signal, bike lane or something like that put in, that's huge. That's really powerful, actually. And so, if that's something you want, please go out and talk to your local governments about it. And just to give you a little example of the last mile issues, so you kind of maybe understand a little bit more what I'm talking about, and to not make it sound like I'm picking on anyone else, this is actually our campus. I'm in this little pink square talking to you today. And when I was moving here and trying to figure out where I was going to live and how I was going to get to work, I knew I didn't want to only have the option of driving. So I looked at public transit and I looked at biking. So this X here up on Fitzsimmons Parkway is roughly where there is a transit stop. Now, as the crow flies, that's only about a half mile from our campus. So 10-minute walk, easy, great, except you can't get there from here. So there's this kind of golf course in the way, there's roads that don't go through. So I had a last half mile issue. And you would actually have to kind of take this really long roundabout way that turns it into a mile. And now there's actually a master plan to kind of create some cut-through roads, and so that will actually improve and become a doable thing. But at the time that I'm looking, it was not. This sort of blue circle is how I would have to come to bike to work. And so as you can see kind of on the left side of the screen, I'm coming from, I guess, the west there. And there's all these small roads. A lot of them have some bike lanes and things on them. It's actually really easy to get from where I live to those 2 blocks. And then those 2 blocks are a huge, fast road, 2 lanes of traffic each way, high speed, doesn't feel safe. And so that was actually, for me, I was very determined to bike, and I kind of figured out mostly a way through it, and I really just kind of grit my teeth through those last 2 blocks and hope no one hits me. But, if you have someone who's a little bit less determined, a little bit more scared about getting out on a bike, again, it's a 2-block issue. And that's certainly within the realm of geography that, this campus has influence over, and that, any local, legislator or local DOT would definitely listen, if the university came and said, gosh, we have all these major roads around us, and what can we do, to make it easier for people to walk and bike. And just to, kind of give it a nice little example, it doesn't always have to be a huge thing. It doesn't always have to be, the fight of taking away a traffic lane from drivers or a parking lane and putting in a bike lane, even though that's what, again, in the active transportation world, we're often fighting for. There are a lot of actually pretty simple solutions. And so this is a nice little solution from some of my colleagues up at Fort Collins, where they made essentially a 5-mile bikeway corridor, which was really just essentially a bunch of slow traffic speed streets that people were already using to bike along. So they didn't even have to put in bike lanes because people felt perfectly safe on these low traffic streets biking. What they ended up doing was at these 4 sort of red dots, these were places where these low traffic streets were encountering big high speed streets. And so these were the sort of pinch points and the trouble spots. And so they actually installed these kind of, they're called toucan intersections, but they're just slightly specialized intersections where you can essentially, press for a pedestrian or a bicycle cross signal, so that you're not sort of risking your neck, trying to get across a really high-speed, high-traffic street on your own. So there were previously basically just like stop signs there, and they made it a slightly safer crossing. So really they got 5 miles of people being able to bike, to work, to campus, whatever, out of putting in 4 intersections. So, listen, I guess, to your, colleagues in the transportation and planning world if this is something you're trying to do, because you may be able to do it for a lot less trouble than you think you will be able to. And I promise it won't hurt. So one other concern people often have is, well, if we take away some parking or some, transportation lane, some driving lanes around my business maybe is somewhere that people come to buy things or to do business, I'm going to lose revenue. And that's actually been shown repeatedly not to be the case. So this is from a study in New York where they actually used sales tax data, and they looked at streets that had undergone things like putting in pedestrian plazas, bike paths, intersection redesigns, or putting in bus lanes. And they actually looked at those streets before and after those changes, as well as comparing them to other streets that didn't undergo those changes. And they actually found that there were increased sales tax revenues in those areas that had undergone the street improvements. Now you might be saying, well, yeah, New York, right? Like everyone takes bikes and takes transit and everything in New York. It's a different beast. It is a different beast, but they've done a similar study in LA, which is the capital of driving, right? And it actually found that, again, narrowing the road and slowing speeds on the road had no effect on the sales tax revenues, and that the revenues actually, some of them actually went up. And another study at a Target store actually found that the bicyclists who visited the store not only made more trips, but actually spent more money per trip than car drivers. So I promise it won't hurt. All right. So now we'll spend a couple minutes on the really super awesome, but might be a little bit of an intimidating comprehensive approach. And here I'm going to talk about the comprehensive transportation plan of Seattle Children's Hospital. They're really recognized as being like the leader in this field. This is something they did both because of traffic concerns around their campus and I think for employee health. And so what they did was they had sort of a three-part plan where they're looking to reduce vehicle traffic, and we'll talk about the details of how they did that, making traffic flow more efficiently around the campus, doing some sort of construction and corridor things with the streets, which we won't talk about too much, and then improving the biking and walking atmosphere around their campus, which we will talk about a little bit. So again, I said you got to hit the parking. So they actually ended up doing this by making it so that employees could not purchase monthly parking passes. They had to make the decision every day if they were going to park to buy a parking pass. And, you know, it's a little bit of just sort of behavioral psychology trickery, but it's really effective. I was telling Michelle just before this that I actually sort of impose this on myself in the summer and fall months. And I don't buy a parking pass for my work, and I, you know, make myself buy daily parking if I'm not going to bike in. And it just gives you that little bit of pause to go, yeah, I feel like being lazy this morning, but also, do I want to pay, you know, X amount of dollars every day to be lazy? And it gives you just a little bit more, you know, thought about what you're doing than if it deducts every month from your paycheck and you never have to think about it and you just drive. They actually then doubled down on that financial incentive, and, you know, employees who drive alone have to pay for parking, but those who get to work by bus, bicycle, carpool, vanpool, et cetera, on foot, actually get a bonus in their paychecks. So not only are they not paying for parking, they're actually getting a bonus. So again, they really rigged the financial incentives to promote the healthy behavior. To address some of the concerns of the employees, they actually have an on-site, essentially kind of a car sharing, zip car type service for people who have to like make midday trips, go to meetings off campus, you know, maybe go to site visits or home visits. They, you know, made that more doable for them to do without bringing their own car to campus by offering car sharing vehicles. And they also are working on supporting more on-site services like, you know, cafeterias, coffee shops, daycares, so that, you know, people don't necessarily need to do extra trips or car trips to get their kid to daycare or, you know, to pick up lunch. So that was sort of a little bit more of the stick side of things with discouraging car use. The carrot was they provide transit passes for all of their employees. They actually provide, again, that last mile, right? So shuttle service from some of the more regional transit hubs that might be a little bit further out from their campus, so that, again, people, you know, don't get a mile from campus and then go, I can't get it from here. And then they also offer what's called a guaranteed ride home, which is, again, something that's pretty straightforward to implement, and you know, can even be implemented separate from this sort of comprehensive plan. So that's basically where, you know, your company will provide a voucher for a free taxi ride home if there's an emergency. So, you know, normally if you take transit or you carpool or you walk or your bike, and then all of a sudden, you know, even if you carpool, say, and then your, you know, your kid's daycare calls and they're sick and you need to come pick them up, and your carpool is not ready to go home, right? That's an issue. That's something people might worry about. So this is a situation where you can, you know, go to your employer and get this free ride to take away that concern. And then finally, to encourage biking, they actually have this program where people who pledge to bike to work at least 2 days a week can actually use a bike from the company free of charge. Just it's theirs to use as long as they continue to commute by bike 2 days a week, which is a pretty cool benefit. They also have some electric assist bikes, which people can check out for midday trips. So again, this is a bike where you pedal, but you get a little bit of a boost, you know, so that you're not necessarily sweating and huffing and puffing, and you can make it up hills and things like that. So that people who, again, maybe need to make a midday trip off campus can do so, and can do so without worrying about showing up at a meeting, you know, drenched in sweat. And then finally, you know, some of these simple things that we talked about, right? They provided more showers and changing areas. They have bike parking for up to 600 daily cyclists, so they really scaled up their bike parking. And they offer a $100 gear bonus for those who bike or walk to work that they can use, you know, again, to get, you know, cycling clothes or, you know, a new pair of athletic shoes to walk to work or something like that. And they did actually do, you know, what I mentioned. They got involved in their local government, and they're funding some bike and pedestrian projects in their neighborhood, and you know, supporting some projects in the neighborhood as well, just to make the walking and bicycling environment around their campus a lot more pleasant. And they actually looked and discovered that a quarter of their employees live within 3 miles of their campus, which is a very bikeable distance from campus, and for those who were a little bit closer, even a very walkable distance. So they realized they just needed to make it a little bit more pleasant to do. So that's the super, awesome, comprehensive version of the plan. That might be a little bit intimidating, I think, for people who are just starting to think about it, and who maybe don't have the weight of a huge university behind them trying to encourage their employees to commute actively. So just to kind of summarize and go back maybe to the basic model, some things you can do and can do pretty easily. I was going to make this a carrot and a stick, and then I decided to make the stick, a candy bar, because really what you're doing is either, facilitating a healthy behavior or a behavior that's not so healthy for us. So, things that you can do. Again, look at the physical attributes of your campus and maybe even a little bit around your campus or your, office space. And see what you can do, just to make cycling and walking and taking public transit just slightly more comfortable experience. Evaluate your policies and programs, and again, see, are there areas of slight flexibility that you can offer people so that, if the bus is a little late, they're not afraid they're going to lose their job? Are there, programs you can put in place, just peer support for figuring out walking or biking or taking transit? Assess your employee benefits. Are you incentivizing driving versus walking, biking, or taking transit by, making one free or cheap and the other one, much more expensive? Are there benefits like the bicycle commuter benefit or the transit pass benefit that you could be offering that you're not? And then really take advantage of, well, that isn't the right, take advantage of your employees, but take advantage of the resources that you have, in your workforce. Look at, who do you know in your workplace who already walks or bikes or takes transit? Talk to them, figure out how they figured it out. There's a sort of behavior change theory called positive deviance, where basically when you're trying to implement anything, you look at the folks who already have it figured out and you see what are they doing that other folks could do. And so, look at the positive deviance in your workplace as far as active commuting and see what they already know and what embedded knowledge is there. One step further, but again, not a really difficult step to make, is, find out who wants to walk or bike or take transit and isn't, and why. And that could be talking to people at lunch, or that could be, doing a survey. But you'll find out a lot, I think, about probably really simple things that are keeping people from being able to do it. It's often, like I say, a problem with the, either literal or figurative last mile of one little issue, and they could do it. And those might be one little issue that you could fix, and other people could do it as well. So, really, really investigate, who's doing this behavior already and who would like to be. And then the stick, the candy bar, is parking. And it really is most effective if you can at least, just ease back on that subsidy that we've been giving to people to park for many, many, many years. It's hard because people are used to it. So they're going to view it as, taking away a benefit or charging them something that they're not used to being charged. But there are, like I say, some things like parking cash out, where you don't have to directly hit them maybe with $300 of parking a month. You can, just make it a slightly less uneven playing field. And I think this candy bar is actually kind of a good analogy for it, because if you think about, people were used to having vending machines in their offices for ages and ages. We could go get chips and, soda and candy bars. And we said, that's not healthy, right? We don't want to subsidize that anymore. We don't want to make that quite as easy a choice anymore, right? So maybe we still have those things, but we also have, a vending machine that has, maybe some fruit in it, or bottled water rather than a soda. So, that might have been changed that in years past, people would have gone, you can never do that. People would be so mad. And look, we've changed it. It's doable. And I believe, this is my final slide. So this, actually, I'm going to give this to Michelle, this link for people to look at in more depth. This is actually a paper about the best practices in promoting active commuting. And this is actually done for the Utah Transportation Authority. So, if you're kind of listening to my talk and thinking, well, this is great for like New York and Chicago and big city places, but we're out here in the West, right? Like things are further apart. We don't have maybe as much public transit or as robust a public transit. This was actually done, for an area similar to probably where you are. And so this is kind of a useful, I think, tool for you to be able to look through. So I'll provide this link to Michelle so that people can peruse this if they would like to. But you can see we've actually talked about a lot of these best practices as far as helping people identify their routes, providing end-of-trip facilities, things like changing the rooms and locker rooms, bike share, bike ambassador program, which again is kind of one of these peer support type programs. Where if you find the people who are already doing that, people who would like to do it, and hook them up, they can help each other figure it out. And tax incentives and discouraging the use of automobiles. So this is something that you can look at on your own, but just to let you know that it is something that was done for Utah. So doesn't have to be a major northeastern city or anything like that to encourage people to walk, bike, and take transportation to work. So that is all that I have for you. Do we have any questions?
Great. So far we don't have any questions, but if you have questions, please feel free to type them in the chat box and we can answer them now. Thank you, Molly. That was really great, and I really loved the practical tools and resources that you provided, and we've seen a lot of our businesses do many of those things. And I just wanted to mention that another thing to keep in mind is that your local bike shops, if you do start implementing some active commuter policy, many of them will come and do a lunch and learn session or a bike safety session or whatever that looks like, and help you get your employees on board and teach them how to use their bike. And I know for me, there are a lot of things that I don't know all the bike maintenance, so it'd be great to have a class for it. So just check with your local bicycle stores, because that's part of what they do, is help people really feel comfortable biking, and will always come and give presentations. And then you can talk with your bike sharing programs if you have them in your neighborhood. A lot of times they'll partner with businesses, and you can develop a program so that if employees, if it's a cost issue where they can't get a bike and you can't yourself provide a bike for them, like some of the big organizations, there are partnerships that can happen as well. So keep that in mind. And yes, there are lots of questions about sharing the presentation. We'd be happy to share some PDF slides and then include the link for the Utah best practices article that Molly mentioned. So I will send those out in a thank you and follow-up email after the presentation today. Yeah, other than that.
Yeah, no, thank you, Michelle. Those are great points. Yeah, local bike shops are a great resource for people who are getting started with bike commuting. Because, yeah, I mean, one thing that I think sometimes people worry about is like, well, what if I get a flat along the way? It's like, well, what would you do if you got a flat in your car, right? Like, you would either, call someone to come help you, which is an option, or, you'd fix it yourself. And it's not, a lot harder to figure out how to carry that stuff on a bike and how to, do it yourself than it is with the car. So it's really just like a matter, I think, of getting that information so you feel comfortable doing it. I think a lot of them too will often be happy to partner with a business and offer a discount or something, if as part of a bike promotion or biking promotion program. You can get a card and get a 10% discount whenever you come into local bike shop. So that's definitely something that you can also do.
Great. Well, it doesn't look like any other questions are coming in. So thank you, everybody, on the webinar today for taking the time to join us. We really appreciate you being here, and thank you, Molly, again, for taking your time as well to present this great information to us. Again, I will send out everything in an email to all of you so that you can share this with your colleagues and friends and whoever you think might find this information valuable. And we will join you for our next webinar in December. Have a great day, everybody.
Thank you.
Thanks.